Okay, we'll be on in just a few minutes, just a few seconds, actually. Okay, well, I think we're on. I'm seeing me on Facebook. Good. I apologize to everybody. I'm not quite sure what happened, but the most important thing is we're here now. So welcome everyone. I'm Glenda Carroll, and this is Mystery Writers of America, the Northern California chapter, Facebook Saturday Live. And this is a chance, an opportunity for our local authors to give short, focused talks on the craft of crime. As we all know, medical mysteries tend to be bestsellers. And there is so much about a medical mystery that we have the opportunity to get things wrong. So today we have Dr. Mary Ray, who is both a physician and a mystery writer. Mary spent 20 years in the emergency room as a physician, and then she went into primary care practice for 10 years. She's also written a book, and I had my notes, and then when here we go. When I lost everything, I put them down, but she co-authored a book called Breakbone Fever, which I hope she chats about for a little bit with her friend, Wendy Venters. So if you have any questions, put them in the comments section on Facebook, okay? And then we'll get to those a little bit later. Let's see, anything else? At the end of Mary's talk, she's going to mention a few links, and I'm going to put that in the comment section so you don't have to worry about writing them down. So Mary, I'm going to disappear, and you can take this over yourself, my dear. It's all yours.
Okay. Well, thank you, Glenda, and thanks to MWA Northern California for inviting me to talk to you. I'm just a few basics. I'm going to be talking about how to make your medical scenes, your medical subplots, or even your entire plot more authentic. And I'm going to be, I do want to be inclusive because I'm a physician, but I do want people to include in their resources nurses, nurse practitioners, physician's assistants, and many others who can help you with the details, medical details you need to make your medical mystery authentic. A little bit of background, of course, there are quite a few physicians who have become authors who are physicians. Of course, Arthur Conan Doyle, Somerset Maugham, Anton Chekhov, Abraham Varghese, and Khaled Hosseini, just to name a few. But it was really Robin Cook and Michael Crichton who were credited with inventing the modern medical thriller. Tess Gerritsen has continued in this vein. She's a physician. Patricia Cornwell and Kathy Reich also are not physicians, but their research is great, and they write great medical thrillers. So a medical mystery thriller is a form of a techno thriller in which the plot does have a lot to do with the disproportionate amount of technical information and the inner workings of a scientific or technical field, in this case, medicine. So in your medical mystery, it's always handy to have lay characters around so that the physician can explain things to the lay person and to your reader that way. If your character is a pathologist, and many times the physician is in contact with police professionals, so that makes a handy connection. But however, medical mysteries and medical subplots can have medical characters and even the protagonists, but their professional status is more in the background. The physician character may provide background that supports the plot, but doesn't own it. In the book that Wanda Venters and I wrote, our protagonists are physicians, and the plot does revolve around a disease, but we try to limit the medical jargon and technical details to keep the pages turning. So a little bit more background. Doctors are storytellers. Every patient encounter ends up with a written note in the medical record. And it's important that that note be written with clarity and accuracy. But doctors are detectives by nature. It's no surprise that Arthur Conan Doyle is a physician. He showed us how keen observation can lead to solving a mystery. And this is well before the onset of medical tests and scans that look inside the body. And of course, many TV dramas and movies about medical mysteries depend on doctor finding clues and solving things really rapidly just based on their brilliance. Well, there's a lot more to it than that. Finding clues to explain a patient's current medical condition can be a grueling exercise. And it's really a lot like a police detective who has to go over the evidence time after time, looking for something, maybe something that was missed. In this case, the doctor has to interview the patient multiple times, interview family members, review lab tests, and keep going over things until maybe something pops up that can help solve the medical mystery. In this case, the real life medical mystery. An unexpected lab test that shows that that's going to need to be repeated. So all of this takes time. And when you're writing, you have to take this time element into consideration to make it realistic. So a responsible physician is going to be very dogged in this pursuit. And a less responsible, uncaring physician will be less responsible in their search. So we could go either way, depending on the kind of character you want in your book. So what do readers want from medical fiction? Mystery Writers of America has a really excellent book called How to Write a Mystery. And one of the chapters is written by Tess Gerritsen, who's been very successful. And she talks about how the medical mystery plays on the reader's desire to kind of learn the secrets and of medical situations, but from a distance. So readers want to know the secrets, but they may not want to be the patients themselves. So it's, in a sense, it's a way to confront mortality from a safe distance. So this brings up the question of how much blood and guts do you want to put into your book? In some medical mysteries, I've been really kind of disgusted by the gory descriptions that come up when people are, I guess, mostly like serial killer kind of things, where very cool, depersonalized descriptions of mutilation can be very accurate, but it's almost as if the reader is a voyeur. And so I would just say to proceed with caution here, because it can be actually seen as a little bit disrespectful. And if so many, as in so many mysteries, so many women are the victims, it can be a bit misogynistic. So my advice is to maintain accuracy, but don't overdo it. Readers want to know, what is it like to deal with things go wrong? And doctors have a lot of experience with things going wrong, and they know very well what happens downstream from these episodes. Medical training involves this right from the start with mortality and morbidity rounds that are part of medical education, a valuable tool in learning from others' mistakes. Hospital quality staffs continue this, and mistakes are followed up upon, and unexpected outcomes, I shouldn't just say mistakes, unexpected outcomes need to be looked at. And these kind of things can, as well as malpractice concerns, can actually cause kind of a change in a physician's character, because they can be pretty difficult for physicians to process. So kind of in that same topic, would or should a doctor break the rules to save a patient's life? I'm going to come back to this a little bit more later, but that's another thing that a reader might be interested in. And then on a more personal level, readers might like to get into the personal lives of doctors. Like, what's it like to be married to a doctor? What's it like to be the child of a doctor, the parent of a doctor? What is it like when the doctor becomes a patient? These are all interesting nuances that could be brought into the characters in your book if they have a medical orientation. And then finally, hospitals are the most dangerous places we will ever visit. And most patients, most readers, that is, have been patients or family members of patients. And so they know this quite well. And so readers maybe want an insider's tour of a hospital. So consider the fright factor of morgues, operating rooms, anesthetics, access to pharmaceuticals, lab errors, infections. These are all good topics that your reader might like to delve into from a distance. So as a writer, what is your objective in adding a medical scene? For example, do you want to provide a chronic undercurrent based on a terminal disease or progressing heart disease? Does your character have a condition that's going to slowly impact the plot, or be a mechanism to inject some acute tension? For example, an ER visit, an accident, a stay in the ICU. Those can come up, pretty quickly and really change your plot trajectory. And a change in a character is also perhaps the result of a medical condition. Your character could be diagnosed with a condition that would change their outlook on life, and therefore there are some pretty interesting plot lines. So getting back to medical jargon and getting it right, how much medical jargon do you want to include, or should you include? So thinking back to the medical thriller, you want to avoid the look how much research I did syndrome. And I have eyedropper to dispense a fact here and there can be an effective tool. The book won't work unless the plot is strong. So despite an abundance of technical detail, it won't work unless you have a good plot. So another consideration is if your book goes into audio, because it might be perfect medical information, but if the reader doesn't pronounce the words right, it's not going to come across and it's going to fail. And, at least to the people who gravitate to this kind of literature, who are often medical professionals. And then when you're trying to get it right, you need to know, how is medical information accessed by the physician and by others? So basically, there is such a thing as the medical record. In olden days, it has, and it still persists in some places, it's on paper. And you picture your doctor with a manila folder with papers and lab slips falling out of it. In about 2010, the electronic medical record became basically much more popular, and it's almost everywhere now, and certainly all hospitals work on an electronic medical record. But in terms of your writing, you're going to want to be sure you get that right in terms of the date when your book is set. So, and as mentioned before, doctors have to scour the medical record sometimes to figure things out, because what happened 5, 10, 15 years ago record, you would think that has made it easier, but actually it has made it deceptively difficult. Even though all of the entries are visible and they're legible, the problem is that many times the same information is cut and pasted, repeated. So even an inaccurate fact or a lab result can be repeated, and that can lead to difficulty in ongoing treatment and outcome of the patient. So that's another thing to consider as a plot device. And then another thing in terms of getting it right is to really to consider patient privacy rules. I think we all have heard of HIPAA. This is the Health, I have to read it, Insurance Portability and Accountability Act of 1996. So if your story takes place after 1996, you want to be careful to be accurate about this. But HIPAA basically limits how much information anybody can obtain from the physician or health professional who has access to the medical record. Doctors and all medical staff have to take yearly training and exams to show that they're educated and in compliance with HIPAA, because any leak in patient information that is not in compliance, the hospital and the physician can be hit with some pretty hefty fines. So there are workarounds. In a criminal investigation and with a subpoena, medical information can be shared. And another simpler workaround that you might need to use is that the patient themselves can give permission for some people to have access to their medical information, but you have to make sure you get that right. And then how to create believable medical characters, that's important. And so I wanted to talk a little bit about the training of physicians. And of course, I would also recommend that if your character is nurse practitioner, or physician's assistant, or any other medical professional, that you check for the requirements. But as for doctors, the first step is going to medical school. And it's hard to get into medical school. But once you're a medical student, it's also kind of hard to get kicked out. You have to show a very serious lapse in ethics, perhaps cheating, or real knowledge base or skill deficit to be asked to leave. It just doesn't happen very often. But after those 4 years of medical school, then you start postgraduate education. That's residency, 1 year, 2 year, 3 years. So it's important to know, if you do have a medical character, that you are familiar with the requirements for that specialty. For example, an internist has 4 years of postgraduate training. A neurosurgeon has 7 years of postgraduate training. So with all of this taken into account, it takes a lot of determination and stamina to make it all the way through. And of course, those are good qualities for either a hero or a villain. You do want to take into consideration these time elements, because the time element will be important when you are trying to create your character's age. There are no 22-year-old doctors. I know I even read about somebody who's 14 and going to medical school. These are just incredible aberrations. So you need to be realistic and count out the years as to when they're done with training and able to go into their practice years. And also, it's very unusual for people to go to medical school later in life, also taking into this time consideration. It happens, but it's not too common. Dress code can be an issue. It can vary with specialty, it can vary with geography and the setting. Is this in an academic medical setting? You're going to see a lot more white coats there. Does the doctor wear a stethoscope? Depending on what the doctor does, it may or may not. These are all good touches of authenticity, and you'd really want to touch base with somebody in that specialty to kind of create an accurate visual of what the doctor is dressed like. Medicine, just because it made it easier for the patients to know I was doctor and not a nurse without asking. And also, I like the pockets. couple of common errors that you want to avoid with creating medical characters. And this can be, time issues. How long does it take to diagnose a condition, to treat it, to recover? All of these things probably take longer than you think. And in kind of a more gruesome aspect, how long does it take to die? For example, gunshots, they tend to be instantaneous, but somebody can be shot in the head and still be alive for a while. You just want to nuance this as you need to for your scene. And then getting the role correct, role confusion is a problem. Make sure that your doctor character is practicing within her scope of practice for her specialty. For example, a psychologist can't write prescriptions, a psychiatrist can. A cardiologist can't do open heart surgery, a cardiovascular surgeon can. An internist will not oversee dialysis for kidney failure. A nephrologist, who is an internal medicine specialist, would do that. And in general, it's incredibly unlikely that a physician will do their own lab tests, start an IV, or push medications through an IV. These are all important tasks done by trained technicians and nurses who have current competence and proficiency. My example, the last time I started an IV was on American Airlines when I was called to an emergency. And luckily everything worked out okay, but a nurse would have done a whole lot better job on that IV. And also going rogue is very unusual. Even if a doctor pulls off some miraculous life-saving measure by flaunting policy, that's really pretty unusual, as you can imagine, partially because after the fact, that doctor is going to be subjected to arduous evaluation and review. So don't expect a doctor who goes rogue and things come out okay to get a pat on the back. It can make an exciting scene, but you have to realize that it's exceedingly unusual. And the same thing, another constraint is the concern for malpractice. Most doctors in practice are continuously afraid possibility of getting sued. So that also constrains doctors from acting in any kind of aberrant way. So research. Glenda is going to provide resources for us in the comments. My number one piece of advice is that when you're doing internet research, make sure that you don't get your research from any place that's trying to sell you something. Just assume that it's not accurate. Go to sites that end in .gov and .edu. But there are a couple of good .coms I'd like to mention. One of them is called UpToDate, and physicians, we use it all the time to get accurate information, and it is kept up to date. If you wanted to delve into a particular condition or to get patient-oriented information from UpToDate, the last time I checked, you can get a subscription for a week for, I think, about $20. A couple of other good resources are the Mayo Clinic, Hopkins Medical, and WebMD. Those are all reliable. Also consider consulting medical specialty organizations, for example, the American College of Surgeons, the American Association or the American Academy of Orthopedic Surgeons, American Academy of Family Practice, et cetera. They often have really good and free information that you could get from there. I did find one link that Brenda will add. This is from a physician named Natalie Dale, and she goes into some specific medical situation. So in one of the take-home points, though, that is most important is to talk to one of us, talk to a doctor, talk to a nurse, talk to a medical professional, and consider other sources of medical information. For example, somebody who is a supervisor of a medical lab, somebody who is the supervisor of a surgical center, and hospital administrators as well. Hospital and clinic administrators, these are almost always non-MDs. And some of them have done with advanced degrees in hospital administration. And they're going to have a different viewpoint on things because they need to maintain accreditation and quality standards in order to keep in business. So although we physicians who are, working online tend to think of them as the enemy, it's they're not. They just are the ones who have to make up the rules, but they can often be quite accessible and help you with information. For example, my co-author, Wanda, for our next book, it takes place in the Denver VA hospital. She asked for a tour, and she got an extensive tour of the hospital. And one of the things she discovered was floors are half floors, which are kind of creepy, but they're used for maintenance. And we use this detail in our book for a pretty exciting chase scene. So there are editing services for straight on medical writing, for research, but there are very few for medical fiction writing. I couldn't find any. But as I said, ask a medical professional. My email will be attached, so feel free to ask me too. So I hope this quick talk was helpful, and I'll turn it over to Glenda now for some of the chats and comments. Thank you.
Okay, sure. This is great. I mean, it just really, you just kind of hit all the key points, things I never would have thought of. I want to know personally, how realistic is it for all these different codes that you hear about on TV? Code blue, code pink, code whatever. Number one, what do they mean? Are they standardized? Does one hospital have the same on the other side of the country? Can you talk to that a bit?
Well, that's a good question. They do not seem to be standardized. Whenever you join a hospital staff, you have to learn what these codes are. And they can go from anywhere from code blue, code black to, which could be a cardiac arrest, to code pink, which could be a child abduction. And there's so many codes that actually nowadays, for the most part, they will give you a little cheat sheet that's plastered onto the back of your ID card. So yeah, there are all kinds of codes for fire, for bomb threat, active shooter. Yeah, you're right. There are a lot of codes. Traditionally, code blue was for a cardiac arrest, but not everybody has to respond. And so, yeah, it can vary quite a bit.
Okay. There's a question here from Patty Dan. She says, do you think you would have written different books if you had written them in your first year as a physician?
Oh, wow. Yeah, of course, I wouldn't have had any time to write during my first year as a physician. And absolutely, I think that it's really, it's so nice to be retired at this point and think back at all the stories that I've heard and the situations. It just takes time to come to grips with what is realistic and what isn't. Thanks, Patty.
Can you talk about your first book, Breakbone Fever? You were just commenting on that to me before everything went black for us on this side, but I thought it was really an interesting plot. Can you talk about that?
Yeah, thanks. So Breakbone Fever was our first book. My colleague, Wanda Venters, wrote it with me. So it's a collaboration. At that time, I was living in Houston, Texas, and I really wanted to go to a beach. And so that meant going to Galveston. I like to go to Galveston to walk on the beach. And then I discovered that Galveston is really a fascinating city, fascinating place. It has a lot of history, and it is also home to the Galveston National Lab, which is a level 4 biosecurity lab where they study things like Ebola. So I got the idea, I thought just kind of generally, well, wouldn't this be a good place to set a mystery? And Wanda, who reads a lot of mysteries, was visiting when I said that, and she said, yeah, let's do it. So the plot, as I mentioned, revolves around a disease, and in this case, the disease is dengue. And dengue is called breakbone fever because of the terrible pain that it causes. And dengue is transmitted by mosquitoes. And as kind of a premise to our book, we have dengue invading the southern part of the United States thanks to global warming. So I kind of take it from there, and somebody in the lab gets murdered. But I hope people like it.
One last question that I have. You talked a little bit about, if a doctor goes rogue, he won't necessarily receive a pat on the back. I'm curious of how doctors are disciplined. What happens to them?
Yeah, that's a good question. There are a lot of ways that doctors are disciplined within the system, because any kind of an unexpected outcome has a very thorough review and root cause analysis. It just goes on and on. And every couple of years, a doctor has to reapply to be on a medical staff. So if a doctor's record is showing multiple instances of these unexpected outcomes, their behavior is unacceptable. That's another issue that has to be dealt with. They may not get reappointed to the medical staff. So eventually it's basically hits them in the pocketbook. And if you're not reappointed to a medical staff in one hospital, it can be hard to get accepted onto the medical staff at another.
Okay, I'm just going to come back on. I just want to thank you again, Mary. This was great. Lots of good information. And to all of you who are so patient with us at the beginning, thank you very much. I'm not quite sure what happened, but I just hope it doesn't happen again. So I'm not sure when our next Facebook Saturday Live will be, but some of our upcoming topics that have been sort of volunteered by all of you is Scrivener, how to use Scrivener to, kind of plot out everything. And we had one Facebook Saturday Live that was including sex or not and how you do it. That had to be canceled. We'll be rescheduling that. And someone wants to know how to create a good ending of a chapter that leads in to the next chapter. So we're looking into all 3 of those. And as soon as we get information on them and get some dates planned, we'll make sure you all know. Thank you so much for tuning into us today. I have 3 of the links that Mary wanted up, and I'll look for some others because you gave me 2 lists, so I'll put that up. And if you have any questions, feel free to put them back in the comment section and we'll go back and answer them for you. So again, Mary, thank you so much. And we will see the rest of you in the upcoming months. Bye-bye.